Hantavirus explained, silent lung infection that can kill in days, warning signs and prevention. If you are over 60, stop what you are doing for the next few seconds because one simple mistake that millions of older adults make every year in their own garage, basement, shed, attic, or vacation cabin could quietly put their lungs at risk before they even realize something is wrong. And what worries me most is this. Many people feel completely fine at first, only to suddenly find themselves struggling to breathe days or even weeks later, wondering how something so serious could happen after something as ordinary as cleaning a dusty room. So I need you to stay with me until the very end because the number one thing every adult over 60 should do to better protect themselves is something almost nobody talks about, yet it may be one of the smartest health decisions you make this year. But before we begin, welcome to the channel. If you care about protecting your health, staying independent, keeping your energy, and learning practical medical information specifically designed for adults over 60, take one quick second right now and subscribe because every week I share research-based health guidance in a simple, calm, and honest way to help you stay healthier and stronger as you age. And before we jump in, I genuinely want to hear from you because your stories matter in this community. Tell me in the comments right now, how old are you and have you recently cleaned a garage, attic, basement, cabin, storage room, or any dusty place where mice may have been present? Be honest. You might surprise yourself once you stop and think about it. Today we are talking about something called hantavirus, and if you have never heard of it before, do not feel embarrassed because many people haven't. Yet despite how unfamiliar the name sounds, this is something every adult over 60 should understand because the way exposure happens is surprisingly ordinary. The symptoms are often mistaken for something harmless, and the consequences can become serious faster than many people expect. Let me be clear right from the beginning. My goal today is not to scare you. Fear without understanding helps nobody. My goal is to help you feel informed, prepared, and confident because one of the strongest forms of protection we have in medicine is awareness. Awareness changes behavior, and behavior changes outcomes. Imagine for a moment that your body is a house and your immune system is the security team protecting every room inside. When we are younger, that security team reacts quickly. Recovery happens faster. Our lungs bounce back more easily. The body has more reserve. But after 60, even in healthy adults, things naturally change. Lung function gradually declines. Recovery slows. The immune system becomes less efficient at recognizing and responding to certain threats. This does not mean your body is weak. It means your body deserves smarter protection than it needed 30 years ago. And that is exactly why today's conversation matters. Hantavirus is primarily carried by rodents, especially mice, and unlike common illnesses that spread from obviously sick people, exposure often begins during something completely ordinary. Maybe spring arrives and you decide to finally clean the garage after months of putting it off. Maybe you open a vacation cabin that has been closed all winter. Maybe you organize old boxes in the attic or basement. Maybe you clean out a dusty garden shed or storage room. Everything feels normal, familiar, routine. But what many people do not realize is that rodents sometimes leave behind tiny droppings, dried urine, saliva, or nesting material in enclosed areas. Over time, these materials dry out and mix with dust. Then one ordinary afternoon someone walks into that space, opens the door, grabs a broom, and begins sweeping. Suddenly, microscopic particles become airborne, invisible, silent, impossible to notice with the naked eye. Yet with one deep breath, those particles may enter the lungs. And what makes this especially dangerous is that many people never realize anything happened at all. There is no dramatic warning, no pain, no moment that feels frightening. You simply continue your day. You finish cleaning. Maybe you take a shower, eat dinner, watch television, go to bed. Life feels completely normal. Days pass, sometimes even weeks. Then one morning something feels different. At first, the symptoms may feel small enough to ignore. Maybe you wake up unusually tired. Your back feels sore. Your muscles ache. You feel chilled even when the temperature seems fine. You develop a headache or mild fever. Maybe you feel nauseated or unusually weak. Most people assume it is a cold, seasonal flu, exhaustion, or simply part of getting older. They tell themselves, I probably just overdid it. Or, I'll feel better tomorrow. But this next part matters, especially for adults over 60, because for some people symptoms suddenly change. Breathing becomes harder. Walking upstairs feels unusually exhausting. Carrying groceries suddenly feels difficult. Taking a deep breath feels different, almost like your body is working harder than usual just to get enough air. Some people later described it as feeling like they could not catch their breath no matter how hard they tried. Imagine your lungs trying to work normally while something invisible quietly interferes with every breath. This is one reason awareness matters so much, because many people miss the connection between symptoms and that dusty space they cleaned weeks earlier. Let me ask you something honestly. How many times in your life have you cleaned out a dusty garage without gloves? Swept a basement floor? Opened an old shed and started moving boxes around without thinking twice? Probably more times than you can count. Most people have. In fact, if that sounds familiar, type me in the comments, because I think many people watching today will realize they have done exactly the same thing. And please do not feel embarrassed if this sounds like you. Nobody taught most of us to think about hidden risks like this. We simply cleaned and moved on with life. But once you know better, you can protect yourself better. So let me walk you through 5 smart things every adult over 60 should start doing right now to lower risk and better protect themselves. Number 5. Start paying closer attention to spaces around your home that may quietly attract rodents. Garages, basements, attics, crawl spaces, barns, storage rooms, vacation cabins, outdoor sheds, even in used vehicles. You are not looking for danger around every corner. You are simply learning to notice clues. Small droppings, torn insulation, chewed food containers, shredded paper or fabric used for nests, strange smells that seem musty or unusual, small signs that rodents may have quietly passed through without being noticed. But here is the mistake many people make. They immediately grab a broom and start cleaning aggressively. Please slow down here, because this matters. Sweeping dry dust or vacuuming rodent debris may stir tiny particles into the air, making them easier to inhale. Instead, open doors first. Open windows. Let air circulate before doing anything. Sometimes slowing down protects you more than rushing in. Number 4. Stop thinking protective equipment is only for extreme situations. I understand the mindset, because many people think, I've cleaned garages my whole life and nothing bad ever happened. But wisdom means adjusting habits as the body changes. Gloves matter. Ventilation matters. A good protective mask during dusty cleaning matters. Not because you are weak, but because you are wise enough to protect what matters. And after 60, your lungs matter more than ever, because lung health affects energy, sleep, independence, stamina, travel, hobbies, and quality of life. Number 3. Never underestimate flu-like symptoms after cleaning dusty, enclosed spaces. Fatigue, fever, chills, muscle aches, headaches, unusual exhaustion. If symptoms like these appear after time spent cleaning areas where rodents may have been present, pay attention. Your body communicates. Wisdom means listening before symptoms become impossible to ignore. Imagine someone in their late 60s cleaning an old shed on a property they have owned for years. Nothing unusual happens that day. Everything feels fine. A week later, they feel tired. 2 days after that, they struggle to breathe and suddenly realize something feels very wrong. Stories like this are exactly why awareness matters. Not because panic helps, but because preparation helps. Number 2. Never dismiss breathing changes as just getting older. I want to repeat that, because this matters deeply. If flu-like symptoms suddenly turn into shortness of breath, unusual chest heaviness, or exhaustion after cleaning rodent-prone spaces, please pay attention. Acting early matters. Timing matters. Sometimes seeking medical attention sooner rather than later changes everything. And before I tell you number 1, if today's conversation is helping you think differently about protecting your health, take 1 second to like this video, because it helps more adults over 60 discover practical information like this. Healthy aging is not only about eating better or walking more. It is also about understanding invisible risks and protecting the independence you worked so hard to build. And now number 1, the thing almost nobody does, yet it may be one of the smartest decisions adults over 60 can make. Talk with your doctor before problems happen. I know that may sound simple, maybe even boring compared to what you expected, but prevention works best before emergencies begin. If you spend time in garages, sheds, barns, gardens, storage rooms, vacation cabins, or dusty enclosed spaces, bring it up during a routine visit. Ask questions. Understand warning signs. Learn which symptoms deserve immediate attention for your body and medical history. Because healthy people are not always the luckiest people. Often, they are simply the people who prepare. And before we finish today, let me say something important because I know some people may feel nervous hearing all of this. Please do not leave this conversation afraid to enjoy your life. That is not the message. The goal is not to stop gardening. Not to stop opening the family cabin every spring. Not to stop organizing your garage or basement. The goal is simply to do these things more wisely. Open windows. Let spaces air out. Avoid stirring dust unnecessarily. Protect yourself when appropriate. Listen to your body. Respect symptoms instead of dismissing them. Small decisions today may protect something very important tomorrow. Because independence matters. Energy matters. Being able to travel, spend time with grandchildren, enjoy hobbies, care for your home, and wake up feeling capable matters. Healthy aging is not about avoiding life. It is about protecting your ability to keep living it. You are not helpless. You are not powerless. You are experienced, capable, and wiser than you probably realize. And learning one important thing today may help prevent something serious tomorrow. Before you go, tell me honestly in the comments, have you ever cleaned a dusty space without thinking twice about rodent exposure? And what surprised you most from today's conversation? I genuinely want to hear from you because your experiences help shape future videos for this community. If this helped you even a little, subscribe and share this video with someone you care about because sometimes one simple share reaches exactly the right person at exactly the right moment. Stay healthy, stay informed, protect your independence, and I'll see you in the next video.